our respiratory system. So our means of course, breathing, getting oxygen into the system. And going through the functions, well, this first term, to ventilate, that means, of course, to get air and, of course, the particular gas, oxygen. So we need to bring that into our body. So as we breathe, our lungs produce this suction force and we draw air, we ventilate air into the body. And as it passes through, especially through our head, nose and mouth, through our head, it heats up with our body temperature. We have an important function of increasing the humidity, the moisture within the air, as well as we have structures in place to help clean and filter the air. So we have this direct interaction with the cardiovascular system. So again, getting that oxygen into our pulmonary circuit, loading up the hemoglobin of our erythrocytes. And of course, carbon dioxide is now traveling in the reverse direction as we exhale and release that chemical from our body. We have the structure of our larynx and our vocal cords, and that vibration allows us to, of course, speak and make sounds specifically. And these other 2 points here we'll touch on minimally. So we covered the white blood cells and now the lymphatic system. And at this point, we're seeing how we have white blood cells that are embedded in the structure of our lungs, so ready to respond to infection. And more of a trait for physiology coverage, but the carbon dioxide that's in our bloodstream has a direct interaction with our pH, a direct effect. So as we remove carbon dioxide, that helps us to maintain our pH, so our acid-base balance. So we see the system here, and we could ventilate through the nose and through the mouth, and we'll talk about those areas. In either case, both areas, the nasal cavity, the oral cavity, lead to the pharynx, and we want to continue, of course, through the trachea, the bronchi, into the lungs. So that respiratory system view that we were just seeing is divided into 2 principal regions. So we have the superior section known as the conduction zone. And this is truly an area where we're just transporting the air from the environment and bringing it, of course, into the structure of the lungs. The majority of the organ system fits into this conduction zone. So as we said previously, we're adding the moisture to the air, which is important to the deeper tissues of our lungs to have some degree of humidity. There are structures along the conduction zone to clean the air of any particulate matter. And the exact boundary is spelled out here. So whether we breathe through the nose or the mouth, when the air from the environment enters our body, and there's several steps until we reach what's called the terminal bronchioles. And this is now the end of the conduction zone, which is rather deep into the lungs to get to these bronchioles. And now beyond the terminal bronchioles, the remaining segment's known as the respiratory zone. And this is now close to the capillaries of the pulmonary circuit. And the function here is truly now the exchange of oxygen and carbon dioxide. And the ultimate final step of the respiratory system are these structures called alveoli. So these millions of tiny little air chambers that are within the lungs, and hundreds of millions of these, are in direct contact with the capillaries of our cardiovascular system. So again, spelled out here, the exact boundary, starting from the terminal bronchioles. The next step is respiratory bronchioles, and that will begin the respiratory zone all the way to the final structure of the alveoli. So we're going to work our way through the nose, mouth, and pharynx, and we'll work our way ultimately down to these alveoli. Internal surface of our respiratory system, there's a lot of hollow cavities, right? The hollow space in your nose, the hollow space in your throat and trachea, and the same applies throughout your lungs. So all of these hollow cavities are lined by some type of epithelial tissue, and in many areas, but certainly not every area of the respiratory tract, in many areas we have a particular epithelium. It's considered the respiratory epithelium. And the particular type of epithelial tissue acknowledged as this respiratory epithelium is the pseudostratified ciliated columnar epithelium. So this exact type here gets the designation of respiratory epithelium, and it is quite common throughout the respiratory system. And interdispersed between these columnar cells, there's now mucus-producing goblet cells. And this mucus itself is a part of the filtration system. If we inhale some dust, the mucus and that thick viscous mucus can now start to trap and collect any dust, any particulate matter. So that dust and material won't penetrate deep all the way into the lungs. It's more likely to get trapped somewhere in the mucus, say in your nose and your trachea and whatnot. So now deep to the epithelial tissue, we have now a structure of connective tissue known as the lamina propria. And just whenever we have this arrangement, any location in our body, when we have superficial epithelial tissue, and then the deeper connective tissue, this arrangement, superficial epithelial tissue and deeper layer connective tissue, this is the structure of some type of membrane. And now that it's coated in mucus, the same mucus produced by goblet cells, this is now known specifically as a mucous membrane. So the epithelial layer, and in different portions of the respiratory system, there are various types of epithelial tissue. The pseudostratified ciliate columnar is just one common type in many areas. There's the underlying connective tissue layer known as lamina propria, and that covering of mucus, again, aids in filtration, and now we have this mucus-covered membrane. So we can see a function of this here. A person has inhaled, and just some particulate matter in this case gets trapped in the mucus. Now with the action of the cilia from the pseudostratified ciliated columnar epithelium, the cilia will now sweep and brush in rhythm. So there's movement of the cilia, and ultimately the mucus and trapped particles will get swept out of the airway, out of the bronchi, out of the trachea, and ultimately any material could be cleared out of the airway, and then we'll end up swallowing that down the esophagus. And our digestive system, of course, can handle this material, but we want to clear this out of the airway. So now we're going to start entering into the system. And the primary site, the principal site where we breathe through, is through our nose. So our quiet, resting levels of breathing is called tidal breathing. We're breathing through our nose primarily. And the nose itself is much better at increasing the humidity when compared to breathing in the mouth. The warm air, of course, is heating up as it enters our head, so entering our cranium and just heating up with our body temperature. Again, the mucus production that's in our nasal cavity, as well as the hair, right? The hair that develops in the nasal cavity, both of those help to collect any material and filter out any particulate matter. And these final two traits, again, related just to the nasal cavity itself. The structure and shape of our nose does, of course, play an effect on the tone of our voice, as well as we use our nose for our sense of smell. And we'll definitely come back to this once we get into the nervous system. So it's a principal site for breathing as opposed to our mouth for just heavy volumes of breathing. But the nose is a better filter and the air is cleaner. Here we're just describing some of the anatomical features, and we'll see these, of course, in the lab section. But the term for our nostrils, just the external nares, just that anatomical term, leading into the nasal cavity. And within this structure is where we see the area of the ethmoid bone, as well as the inferior nasal concha. So we have these branches, these ridges of bone, and the air circulates between these areas, specifically in the area of the nasal meatuses. And I'll just go ahead and fix that. So meatus is that proper plural term. When the air is flowing through the meatuses around the various nasal concha. Another lab term, the hard palate. This is the bony structure that separates the nose and the mouth. So it includes the maxilla and the palatine bones, and together make that bony ridge between the nasal and oral cavities. And lastly, we'll see this on a figure. As the nasal cavity then tapers down in size, it leads to this narrowed region called the internal nares, and this serves as the border between the nasal cavity and the superior portion of the pharynx, the nasopharynx. So to view that, of course, on a skull, here we are seeing the nasal cavity separated by the nasal septum down the midline. And here's the terminology of the nasal concha, with the nasal meatuses being the spaces between. And it's in this area, of course, is where the air is flowing through the nasal meatuses. And just another look at that, we see here those nasal conchae. So again, these bony ridges, and the air flows and swirls actually around them. So now moving beyond the nasal cavity, we have the narrowed area of the internal nares, just illustrated by this dashed line. And that's now the boundary for the first superior section of the pharynx. The pharynx itself is used, of course, for breathing as we're describing, as well as later on we'll discuss the digestive system as we're swallowing and consuming food and liquids. So it has a dual purpose overall. The nasopharynx, however, is only used for breathing as part of the respiratory system and spanning from the internal nares to the uvula. And we could go ahead and just box this in here. So from the internal nares to the uvula, we have the first section of the nasopharynx. Oro is in mouth, oral cavity, extending from this same area, the tip of the soft palate, and down to the epiglottis. So posterior to the mouth, this second portion, the oropharynx. And now the inferior region, this is now a junction now between the larynx and the esophagus, the larynx and the esophagus. And we can see that boundary of the hyoid bone as this area now for the laryngopharynx. And taking a closer look at each of these areas, we have some distinctions between the three sections of the pharynx. So again, the superior nasopharynx is truly only involved with the respiratory system. And in fact, in the moment when we're swallowing, ingesting material, it does close off. We have one of our lymphatic organs, our pharyngeal tonsil is located in this region. And we've seen this with the lymphatic section. And we see a connection now to the nervous system, specifically the middle ear. We have a structure known as a auditory tube, or commonly called a eustachian tube. And this connects the area of the middle ear to the region of our nasopharynx. And again, we'll come back to this function once we study the special senses, once we study the ears. The next section, inferior now, the oropharynx is distinct. This is an area now where we no longer have the respiratory epithelium. So instead of having the pseudo-stratified ciliated columnar epithelium in this location, instead we have the multiple layers of the flattened cells, stratified squamous. And this is important because the oropharynx, again, oro's in mouth, this is the area where we're ingesting food. So we're swallowing food down this region, and we want that protective layer afforded by stratified squamous. And you notice, again, from the lymphatic system, 4 remaining tonsils in this region as well. And continuing now to the laryngopharynx, this is now the junction point between these 2 organ systems, digestive and larynx. So again, the digestive system, that leads, of course, from the esophagus for the ingestion of food. And the larynx will now continue in for the respiratory system for the ventilation of the lungs, the delivery of air. So this is, of course, the pathway we're going to follow from the larynx. And it's at this location is what's commonly called the vocal folds. So it's this structure here right across this open space. So just the border of that open space is the vocal folds. And it's truly here the thickness, the tension, the vibration of our vocal folds. This is primarily what determines the sound of our voice. So you can think of these like string on a harp, the musical instrument. Make my little sketch here. You have a harp. And depending on how thick the strings are, how tight the tension, the vibration, this is the primary factor that dictates the sound of a person's voice. There's many other features involved, including just the shape of your nasal cavity. So now directly inferior to that larynx, commonly called the voice box, we're seeing the span of the trachea. And here we're just making a comparison to the vertebrae to the length of the trachea. So we're looking at the bones of the spine. Can't write right now. So comparing it to the span of our spine from our cervical 6 vertebra down to our thoracic 5 vertebra, the length of the trachea. And the trachea itself has hyaline cartilage, specifically hyaline cartilage that wraps around the anterior and lateral sides. So that cartilage, which you could feel right on your throat there, on the anterior side of your neck, of course, that rigidity keeps our airway open, so it prevents our trachea and our airway from completely collapsing. However, the cartilage is only again on anterior and lateral sides is where it's complete. And the posterior end, the tracheal cartilage actually has a big break in it where it's open. And in this location, this does allow for a slight adjustment of the diameter. So when we are swallowing food, we can constrict the trachea slightly, so reducing the size of the trachea, and that allows for more room for the expansion of the esophagus. And again, the esophagus is directly posterior to the trachea. So if we made a quick sketch, we have the tracheal ring. The inside of the trachea does have the pseudostratified ciliated columnar epithelium. That's surrounded by this tracheal ring. And directly posterior to that is the location of the esophagus. So when this trachea constricts down smaller, that gives more room for the esophagus to dilate out. And it's just for that brief moment when we're swallowing. So now we want to move from the trachea, and as it starts to branch, we now have what's called the right and left primary bronchi. So that's the 2 branches down here are the primary bronchi. The first branches off of the trachea. The trachea itself is spanning right down the midline of our thoracic cavity, specifically in that central mediastinum. And it's now from this trachea, we have the first branches of the bronchi, the largest set of bronchi. And we do see this slight imbalance in the shape, which I was trying to draw earlier. The right primary bronchus is shorter, and more importantly, it's at a steeper angle when compared to the left side, the left primary bronchus. So it is more narrow, and it comes out at a wider angle. And the reason being is our heart is not directly in the center of our chest, but our heart is just slightly askew to the left. And to accommodate the shape of the heart, now that left primary bronchus again is at a wider angle, it's a more narrow tube, and it's much longer. So really the opposite of that description for the right side. So given that difference, that asymmetry, it's more likely that if we do happen to swallow something down so far, it'll more likely get lodged in the right side, which is a bigger tube. And again, it's at a steeper angle. And it's from here is where the analogy of a tree comes from, because now after the primary bronchi, it's going to branch again. And the next branches are called secondary bronchi. And the branching is just going to continue. So similar to the tree analogy. So that brings us here. Our primary bronchi, their job, of course, is to deliver air into each lung. And that's the purpose of the primary bronchi, just simply delivering air to the lung. Now, the secondary bronchi, they branch to each specific lobe of a lung. And it's on the right side of the body. The right lung has 3 lobes. Just make a quick sketch of that. So it has 2 divisions and 3 lobes, and the right lung needs 3 secondary bronchi, or you notice the alternate name, 3 lobar bronchi. Whereas the left side of the body, the left lung, only has 2 lobes, 1 division. So it'll need 2 secondary bronchi to the left side of our body. And now we have the next set called tertiary bronchi. After secondary, they split again. And now the third branch point, if we start at the trachea, we have a primary bronchus, secondary bronchus, and now the next branch, tertiary bronchus. So now within each lobe is divided into a number of segments, hence the alternate name. And that's the purpose here, branching to each particular segment within a lobe. So it's at this point now is where we get to the end of our bronchi, these larger branches from the trachea, and we transition to now much smaller branches known as bronchioles. There will be multiple bronchioles, so I can't draw this to scale. And ultimately, what are known as terminal bronchioles, what's important here is these are now the bronchioles that are very end, and they mark the very end of the conduction zone. So at this point, we brought in air and ventilated air through the nose or mouth, down the pharynx, trachea, the series of bronchi, ultimately through the bronchioles and terminal bronchioles. So hopefully at this point, we filtered and cleaned the air. It's heated up with our body. We've increased the humidity, but we're not yet at the pulmonary circuit. And this note here, we could omit just the number of segments. And here's really a much nicer view. So from the trachea, within the mediastinum, branching off, in this case, you notice we're going to the left side. So we have the primary bronchus splitting into the paired secondary bronchi, branching to multiple tertiary bronchi. And we notice from the trachea throughout the bronchi, the blue color is representing the hyaline cartilage. And this cartilage ensures that the airway stays open. But a major shift now is that the bronchioles lack any cartilage. And again, traveling from the bronchioles, at this point now reaching the respiratory zone, the deep areas of the lungs lack that cartilage. So taking a look at the lungs themselves, they're found specifically within the pleural cavities, the lateral aspect of the thoracic cavity. Like organs we've discussed before, they have both a visceral membrane attached to the lung and a parietal membrane lining the pleural cavity. So protecting these organs as they expand and constrict and change shape, and that moisture afforded by the protective serous membranes. The diaphragm is really the inferior side of the lung structure. And so the organ itself, the lungs, sitting and attached right onto the diaphragm. We have our ribs that are starting from the thoracic vertebrae and curving around to the anterior side, connecting to the costal cartilage. So all of that area protected by the ribs, the costal cartilage, that's known as the costal surface of the lung. So this would be the anterior, the lateral, the posterior sides wrapping around. And lastly, the medial side of the lung could simply be referred to as medial surface, or an equivalent term, the mediastinal surface. The side of the lung that faces towards the mediastinum, that central space of the thoracic cavity. And we've already kind of touched on this when we described the number of secondary bronchi. But the right lung, and I'll just draw a little sketch again, has 3 lobes, and the left lung just has 2 lobes. All right, so we have that structure there and the shape. And I just want to draw this from an anterior view to keep it consistent. So anterior view of each of these lungs, and we're able to see again the number of lobes. So separating the lobes, and this is more lab terminology at this point. Separating the lobes of the lung, there's the various fissures. The costal surface again described as the anterior, lateral, and posterior sides. And just imagine the shape of the rib that curves around that. Whereas the medial surface of the lung, just one noteworthy description for it. On the medial side of the lung is where we find a structure called a hilus. And a hilus is just simply a bundle of vessels together. So this is not at all unique to a lung. Many organs have a hilus. And in this case, this happens to be where the pulmonary arteries and veins connect in and out of the lungs. The primary bronchi and the nerves as well. So the entire bundle of vessels come together, and the spot where they penetrate the organ is known as a hilus. So now we have an overlay of the bronchial tree and all the branch points from the primary, secondary, tertiary bronchi, bronchioles, and we can see it now in context with the shape of the lungs, the 3 lobes to the right side, the 2 lobes to the left, and the fissures that separate them. So now we're going to move along to the smaller tubes, the bronchioles. And you now notice at this point, again, we no longer have that hyaline cartilage. So where in the previous sections, there's the protection and the fact that the cartilage will keep the trachea and the bronchi open. lacking cartilage and instead having a full ring, a full circular ring of smooth muscle, we now have at the unconscious level, at the involuntary level, the ability to constrict or dilate the bronchioles. And of course, the two divisions of the autonomic nervous system. The autonomic nervous system involved, of course, in two different components, parasympathetic and sympathetic. And each of these, as we see, have an effect on breathing. So to make sense of this, the parasympathetic division, this stimulates our body to be in a more relaxed state, like a decreased heart rate, for example, a resting state. So in a relaxed state, we have less demands for oxygen, and this allows for the constriction of the airway. So we don't have a high demand for oxygen, and there's constriction. Whereas sympathetic is when we're more active. So a more active state, we're using more energy. An example would be raising the heart rate, you're exercising, running around. And in order to draw in more oxygen to the body, we have to get more oxygen to those working muscles. So our heart rate will go up to beat faster, and we dilate the airway so that we could ventilate and bring in more oxygen. So now we're going to skip all the way to the end of the respiratory zone. And the lung is principally made of, you notice, just tens of millions of alveoli, these small little terminal air chambers. And the alveoli themselves, we see right here on this illustration, these small air chambers. The alveoli themselves are in direct contact with the capillaries of the pulmonary circuit. So again, this is the respiratory zone. This is where we have gas exchange. And aiding in their function, there's a large degree of elasticity. So these same stretchy elastic fibers. And the importance in this case is we always have to use muscles to inhale. So we use our diaphragm and other muscles to inflate and fill the alveoli. And as we stretch out the alveoli and their elastic fibers, they can now recoil and shrink down, and this allows us to passively exhale. So we just relax the diaphragm, and the elasticity of the lungs coming from the alveoli allows us to passively exhale. This issue, of course, is compromised from cigarette smoking. Smoke inhalation in general does damage to the alveolar structure. And now we'll move into types of cells that are located within this region of the alveoli. So the type 1 cells, as they're known as, they are actually simple squamous epithelium. So one layer of the flattened cells. And this is truly the structure that makes the alveoli, the air chambers themselves. So that single layer, simple squamous, the flat, thin cells, that's of course great for diffusion. So the gases, oxygen, carbon dioxide, pass right through the tissue. Whereas now a type 2 cell is now rather important, also known as a surfactant cell. So thus, this is a cell that creates this chemical called surfactant. And to describe this, we'll start with the type 1 cell. The type 1 cell is, of course, making the structure of the alveoli. So we're just drawing a little air chamber here. And now the type 2 cell, the surfactant cell, its purpose is now to produce and secrete this chemical surfactant that lines the internal surface of the alveoli. And the importance of this surfactant is it reduces the attraction, the surface tension between water molecules. The same water that we do want in our lungs to give some moisture, some humidity. We do want some degree of moisture to coat and protect the type 1 cells, the simple squamous epithelium. We do want that tissue to remain moist. However, water molecules are attracted to one another. So if we have, of course, water in this area, the water molecules on one area would be attracted to water molecules on the other side, for example, and that could cause the collapse and closure of the alveoli, so greatly compromising a person's breathing. So with the production of surfactant from these type 2 cells, this helps to, of course, now reduce the attraction between water molecules. So we'll go through and, well, we wanted to erase a little bit of that. So we could now reduce that attraction, and that allows for the ease of breathing and preventing the collapse of the alveoli. And we see that this chemical surfactant is not produced until the latter stages of our development. And then lastly, we touched on this bullet point from the very beginning. We do have some leukocytes, right, a type of white blood cell that's found in this area of the lungs. And again, the lungs, starting from the nasal cavity, the oral cavity, there's all this internal space leading down the trachea and into our lungs. And we could easily spread infection via our respiratory system. So we do have some white blood cells in this area to try to counteract that. So now using this figure, we're now looking at the junction between two organ systems. The respiratory system and the cardiovascular system are great examples, organ systems that directly interact with one another. So now we ventilate in oxygen into the alveoli, and there's just this very thin 3-layered border that separates these two systems. The airspace of the alveoli and the gases can diffuse right in. That oxygen, of course, could load right into our erythrocytes. So seeing what's called the respiratory membrane, the barrier between the cardiovascular system and the respiratory system, the exact site of gas exchange, and the various layers that are involved. We'll start here with the alveoli itself. So we already described the type 1 cells, the simple squamous epithelium. So again, itself a very thin, delicate tissue. There's now the fused basement membrane, or also known as basal laminae. And here's one example where we have epithelial tissue. We have a basement membrane. And on the deep side of the basement membrane, we actually once again have more epithelial tissue. And that's now the epithelium of the capillary structure. The usage of the prefix endo specifically indicates that it's an internal location, whereas epithelial tissue is at the surface, a superficial location. But again, capillaries themselves, simple squamous epithelium, the same thin, delicate tissue such as the alveoli. So making just a very, very thin border between these two organ systems.